I'd like to give a short brief on what we do globally and focus a little bit on what we're doing locally in a Saudi setting, for the past years. So starting with the global perspective, right? And we look at Medtronic, and I think most of you know about the acquisition that happened back in 2015 when we acquired Covidien and we became the largest medical device company in the world. And with that, our patient pool grew significantly. And today, we cover more than 72 patients globally, 72 million patients globally, which is like 2 patients every second, with our diverse portfolio. What I'd really like to focus on here as well, if you look at the number of employees, we do have 90K plus employees that work for Medtronic. But if you look at the percentage of the scientists and engineers, it's more than 10% of our total population or our total employee pool, which is significant. And when we look at that and we look on the amount that is spent last year only on R&D, which is $2.5 billion, it shows the kind of company and medical device company and where we focus our efforts and talents. Beyond patients, beyond people, we don't only focus on technologies, where we also focus on solutions, and we focus on outcome-based models. So we did acquire in 2015 a company that is specialized in value-based models and value-based healthcare. And on the next slide, I'll show you that we already have one proof of concept in a Saudi setting on value-based healthcare, integrated health solutions. Integrated health solutions is also a very big arm for Medtronic to drive services and solutions beyond only technology, and on definitely the PPPs, and we're gonna talk about that later. But if you look at the size and scale of the therapeutics that we do cover more than 70 conditions in the human body. We have 4 portfolios. We have the cardiovascular portfolio, which is our breadth and depth, where we started more than 60 years ago. The MedSurg, after the acquisition of the Covidien company, the neuroscience and diabetes. And when we say beyond technology and beyond products, we're talking about consultancy, we're talking about managed services, we're talking about value-added services that we already have partnerships within the country as well to develop beyond the product and beyond the technology itself. So if I focus a bit on our Saudi operation, we've been active in Saudi for more than 30 years, and we have partners in this room that we knew for more than 15 and 20 years. And 10 years back, probably in 2012 or 2013, we decided to go direct in Saudi Arabia. And that happened in 2015. So it took us 3 years of planning, 3 years of focusing on delivering that promise, and we did that in 2015 through our partners, Gulf Medical. So it's a JV with Gulf Medical Company. That time we started with 48 employees, and we grew over the years until now. Today we're more than 400 employees with 100 direct operations. So all of our businesses that were through distributors are now with Medtronic direct. Our overall to date investment is around 1.7 billion Saudi riyal, and one important piece, when you look at the 407 people that we have, most of them, we have a good Saudization rate with 54–55%. And for our Saudi talents, it's not only for Saudi. So we're exporting Saudi as talents into the region. So we have Saudi talents leading EMEA regions today, not only Saudi, not only the Gulf. So it's with extended responsibilities. And one important piece as well, in 2018, we converted the Saudi headquarters into a Gulf headquarters. So even beyond, before MISA mandated the localized, the RHQs a couple of years back, we did, start our RHQ, and we actively started in 2018 with having our headquarters in Riyadh overlooking the Gulf region. We're training more than 10K HCPs every year. If you look at our patient base in Saudi alone, we have 1 patient treated every minute, which is more than 550K patients annually. And you can see here the distribution on the map. We have very good distribution. And the last piece is localization, Dr. Muhammad, and manufacturing. So I think we are the first medical device company that started that in practice. So in 2020, during the pandemic, we started, the first portable ventilator in Saudi Arabia. In 2021, we, upscaled that partnership into the latest generation ICU ventilator in the world, right? So we have our latest generation done by Saudi hands in Saudi Arabia. And we inaugurated, the first vent in December 2022. As a company, we did get, certified as a great place to work, just recently from October 22 to 23, and we did contribute to the Asia, best place to work for Medtronic, and definitely, that would lead to our, certificate on the world's best places to work as well in 2022. We have different programs that we're focusing on, not only on, the technical aspect, but we look at talents. We look at, collaborations like with MISC Foundation. And we have internship programs that, attract talents from different foundations. And for the past, couple of years, we had 60 interns enrolled in our programs with 70% conversion rate, which is, pretty much significant. That's, the inauguration of both devices. The first device, the portable one, was inaugurated back in June 2021, and we had, excellencies, His Excellency Rabia, His Excellency Madar Al-Khrayef, His Excellency Abdullah Rabia as well, and His Excellency Khalid Al-Falih and His Excellency Rumeh as well in the December 2022 inauguration. Beyond products and beyond devices, so we have three programs that are now active. So the IHS, Integrated Health Solutions, Diabetes, which is a true value-based healthcare model that is applied in Al-Ahsa and actively enrolling patients. And our third program that we plan to bring into Saudi is our Curo program for obesity as well. And thank you very much.